So what's a sinus lift? Why do we need them? Well, our sinuses, we've got a few of them. So we've got the paranasal sinuses, maxillary sinuses in our heads. These are essentially our air spaces, and they're lined with a membrane, which is a fantastic little membrane. There's lots of little what we call cilia on that membrane, and those cilia are passing that mucus in actually a particular direction, and they're cleaning that sinuses from foreign bodies, dust, and then doing that movement, and it's a very uniform movement, and they've got this little flow where they get rid of all the little particles. So when we're sort of working on the sinuses, we need to be very, very careful that we don't interrupt that flow and cause you any problems. Now, essentially what the sinus is essentially like is like a balloon, and what we're doing is we are pushing that balloon very, very gently, and we're moving it back to a place when you used to have roots. So this little membrane that we uncover will then push that membrane very, very gently with whatever instruments we might use. And then we may put some bone in there to keep that membrane up the way, or we may use the implant to tent it. And then what this membrane has the ability to do along with the bone is grow new bone. So there are essentially two types of sinus lifts which you may be considered for. And the reason that you might be in need of a sinus lift is that you don't have enough height when we're looking at the upper implants, usually at the back of the mouth. So what happens when a tooth is removed is you lose some bone. The sinuses can also expand into that space. They may already be very closely associated with the nerves of the teeth. So when that tooth comes out, that sinus may already actually be quite well developed, or what we term well pneumatized. So we may, even before the tooth is taken out, have to consider a sinus augmentation to help you out and put the bone back if we're looking at doing an implant for you. And there are essentially those two types. So one type is where you don't have enough bone to be able to place an implant with any type of stability. So that may be considered as 4 millimeters or less. And if you have less than 4 millimeters of height of bone, then we may consider and talk to you about a lateral sinus lift. Now, this is where we come in through the inside of the mouth, and we have to move the gum. We can see the bone. We very, very gently make a little window in that bone, and so we can see the membrane. And then once we visualize that membrane, we can use little tools very, very gently just to carefully move that membrane away so that we don't perforate that membrane. If we do perforate it, then there are things that we can do to help you out depending on the size of the perforation, but hopefully it won't be perforated. And then we'll pack that bone in that little new space that we've got, put maybe a little membrane over the top, put some stitches in, and then come back after about 4 months and just rescan it, review it, and make sure that everything is healed nicely. And then we'll go in and do a conventional implant placement with hopefully what is lots and lots of new bone around there. The other type of lift is what's called an internal lift. It used to be called a Summers lift. Used to be a little bit, what seems a bit more brutal now compared to what we do these days. So what we used to do is we used to make a little space getting ready for the implant, and then we'd stop just shy. So we'd have a little bit of bone just below that sinus membrane, and then we'd use a little tool to kick up that membrane. Essentially, it was a hammer and chisel, effectively osteotome, whatever you want to call it, and it would crack up that little bit of bone, and it would lift up that membrane. Now, some implantologists may place bone into that internal lift. Me personally, I don't. If I can't see what's going on, I don't know whether we've got a perforation there, and I wouldn't want any bone going into your sinus because that might encourage a foreign body reaction. You might get some inflammation around there. So when we're doing an internal lift, the tools that I use, essentially, it's like a little hydrox, well, what would you call it? A saline pump, essentially. So what that does is we make a little space. We've got some very careful little tools that will drill up to the membrane, but they won't cut the membrane, that delicate membrane that we were talking about. We'll then put a little bit of saline and we'll increase some pressure. And what that will do is that will lift that membrane nice and gently up, and that avoids that tearing of the membrane. It's a very gentle process. And then once that membrane has been lifted, what we then do is we put the implant in to that little space, and that tenses the membrane up and around there. And then what we get is we get bone growth around that implant and where that membrane's been tented up. That means you get your implant a little quicker, but that's because you have more bone and we're able to get stability in the implant, and then just review things. So essentially that's what a sinus lift is. It's working with the sinuses in the jaw when you haven't got enough bone for direct implant placement, or if you've got inadequate bone to cover the whole of the implant that's going into the jawbone with bone. So we're just adding something that you've lost back. It's a fairly simple and straightforward procedure. It does take a little bit of additional training, so your implantologists will have been on other courses to learn how to do this. If you have any questions, just drop us a line. I hope this has given you some information on what sinus lift is. Thank you very much.